Hey guys, now that you maybe got through that stroke series, let's talk about headaches. So headaches can be a headache to learn about, but there's three main types, and a lot of times, when there's different types, students get them confused. But hopefully, this will help break them down so they make more sense. So, first and foremost, let's talk about what is a headache. So, a headache is pretty much just a lot of blood pooling. So, a lot of people wouldn't think this. You think headache, you think, oh, there's all this tension. There must be like constricted blood vessels. But headaches are actually a lot of vasodilation. So, everything kind of is vasodilated in your head, which leads to blood pooling and it puts pressure on your nerves, which leads to that pain. So, the three types of headaches that you're going to need to become familiar with are tension, migraines, and cluster. And I'm going to break each of them down. And they differ in their symptoms, their treatment, and the overall nursing interventions that we're going to do for them. So let's start with tension headaches. This could also be called a nursing school headache, what you're feeling now watching this PowerPoint presentation. The things that make this one different are some of the symptoms. The symptoms, they have pain that's band-like wearing a headband kind of around their head. So it goes kind of here and it goes all the way around their neck. So they can also feel a lot of tension in their neck. There is no nausea and vomiting with this type of headache, just pain. And usually it responds pretty well to basic treatments like acetaminophen, Tylenol, or NSAIDs like ibuprofen. The nice thing about this one, or I guess not the nice thing, but I would say is like the other thing to consider for this one is since there's neck tension and it's kind of that band like pain, we can also use muscle relaxers or heat packs on the neck, and that can help to relieve some of that pain. Now there's I should say, now there's also migraines, which is the next kind of level. I kind of think of these level. Tension is kind of the lowest level, the less serious. And I know if you have a tension headache, you're not going to think it's the less serious headache because they really are not fun. But usually they're pretty self-limiting and they go away with simple medications. But as we're kind of building up to these, you're going to see some of these get a little bit more serious and need a little bit different treatments. So migraines, these are headaches that affect the senses. So what makes them different is usually they start with an aura, and an aura can look very different for different people. Sometimes it's a smell that comes on. People smell like have like they're like, oh, something smells weird, like they maybe smell like flowers or something like that out of nowhere, and then they get their migraine. Other people, they might see kind of like, it's not a hallucination, but it's like they see like altered colors or perception in their environment, and that can kind of come before their headache. Sometimes they can hear something, but it's one of the senses. It's kind of like, think of an aura as like a signal where your body's telling you this is about to happen. You can have them before seizures, but you can also have them before migraines. So patients that have migraines, they can kind of know if they're getting an aura that they need to get prepared for the migraine that's coming. The pain is a little different. Remember, with the tension, it's the band like pain. For patients with migraines, it's one sided and it's usually on the temple area of their head. These patients can have nausea, vomiting. And a lot more of the that discomfort, like the GI symptoms and things like that related to their migraine. The first line treatment for this is what's going to be called serotonin receptor agonist. And these help actually to cause some vasoconstriction that helps to reduce some of that pressure that is getting on the nerves in the brain. These can we can help to, as a whole, get towards decreased pain from their migraine headache, and also sometimes prevent some of the other symptoms as well. So other things I want to teach this patient that has migraine headaches is to avoid triggers. So if there's things that can trigger them, like some people, it's like, hey, when I eat chocolate, I get a migraine. That's going to kind of suck. But if you know that's your trigger, then you can try to avoid it. Kind of think of it like allergies, like we try to stay away from our triggers. We also want to modify the environment. Usually patients that have migraines are sensitive to light and sound. So if they're have a migraine or getting one, they're having an aura, we want to get to an environment that has decreased light and decreased sound to kind of decrease some of those symptoms that they're experiencing. Then the worst type of headache that can happen is what's called a cluster headache. And other people that have migraines and stuff, they may disagree, but they've never had a cluster. But these are considered the worst type of headache. And they come in what are called like in clusters. In other words, like they come like they're kind of like exacerbations and remissions. And so when patients have cluster headaches, they can get them up to 8 times a day. And that's what's something that's a little different. Usually with migraines or tension, they come and then they're gone. It's not something that you're having that many times a day. The thing that's also different about cluster headaches is they kind of look like allergies. So in other words, like the patient, they actually have like on one, instead of the temple, Like for migraines, they have symptoms around their eye. They can have eye watering, redness. It almost looks like they're, they are having allergies just in one eyeball. It's just dependent, of course, where their cluster headache is, which side it would be, but it's on one side. So a lot of times it looks like allergies but it's just one eye instead of both. Um, we also treat these with serotonin receptor agonists, but the thing that's a little different too is we treat these with oxygen. So oxygen is a potent vasoconstrictor. So if we give oxygen for these headaches, they actually can really help these patients. And a lot of them are going to go home and be on oxygen, not all the time, but they're going to have an oxygen tank so that when they get a cluster headache, they can put that oxygen on, and that can help to relieve their pain. Um, to kind of get them ready. So these are the worst type of headaches that a person can have. And obviously, they're a little bit different in the severity, the symptoms, and then some of that treatment we're going to do too. So this is just kind of a basic breaking down the headaches. Definitely recommend kind of looking in class and kind of piecing together some of those other things that you're going to see that are going to differentiate these from one another. Hope this was helpful. Bye.